Good afternoon. If everyone could please take a seat, try to maintain social distancing as you're seating, but we'll get started here in just a minute. Great, we'll get started. So first of all, I'd like to thank everyone for attending this joint meeting between the Casper City Council and the Natrona County Board of County Commissioners. My name is Eric Nelson. I am the county attorney. I'll be kind of kicking things off and then turning it over to representatives of the health department, the medical community, to address the current status of the COVID pandemic here in the community. Initially, so since we do have an official meeting of the county commissioners, I will take a roll call. Chairman Hendry? Here. Commissioner Bertolio? Here. Commissioner Chadwick? Here. Commissioner Milne? Here. Commissioner Kaufman? Here. And would everyone rise and please join us in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So again, Mayor Friel, City Council, Chairman Hendry, and County Commissioners, thank you for being here this afternoon. As part of my duties as the County Attorney, I represent the Casper and Natrona County Health Department. The department and our county health officers have asked for this opportunity to address both the council, the commission, and the public today regarding what it sees as an alarming rise of COVID within our community. I want to, first of all, maybe dispel any notions. There are no action items today. There will be no votes taken today. There will be nothing passed in terms of a mask mandate, or any other restrictions, heightened COVID restrictions that aren't already in place through the statewide orders. What the primary purpose of this meeting today is to provide information to our elected officials and community as to the current status, and then ultimately to ask everyone to pitch in so that we as a community can defeat this pandemic. You'll hear from Anna Kinder, the Executive Director of the Casper and Natrona County Health Department, Dr. Mark Dowell and Dr. Ghazi Ghanem, our County Health Officers. You'll hear from Dr. J.J. Bleichert, the CEO of Wyoming Medical Center, Dr. Andy Dunn, who is the WMC Chief of Staff and a Health Department Board member. We'll also then hear from Mike Jennings from the school district and Dr. Darren Devine from Casper College to give an update on the COVID situation in their respective institutions. At the end, we'll take questions from the elected officials, and the health department will then summarize where we stand and where we're headed at this point. So at this juncture, I would turn over the podium to Ms. Anna Kinder.
Thank you, County Commissioners and City Council, for allowing us to come together for this opportunity to talk with you. I come to talk to you today about COVID-19 and the effects that it's having on our community. 3 weeks ago, Natrona County had 178 new cumulative cases in 1 week. 2 weeks ago was 228, and last week was 341. Our current total case count is 1,388, with 300 probable cases. As a county, we were the highest for the week as far as counties in the state. Our state has seen the highest count overall of new lab-confirmed cases daily, which every day they surpass the previous day. Last week alone, they've had 2,185 cases. Our positivity rate for Natrona County is well over 20%. Currently, we have 200 cases or more that we are working to do contact tracing. Working every day and until late, the sheer number of cases that are coming in daily makes it the inability to contact everyone in a timely fashion. We've engaged the National Guard to help us with this process. However, they too are also significantly far behind in the number of cases that they're doing for the state. Some of our most valuable resources are suffering the impact. Well over 175 positive residents in long-term care and assisted living are who we're dealing with. 80 staff out of long-term care and assisted living. 4 residential and communal living facilities have seen more than 10 deaths in the last 15 days. We anticipate likely 8 more soon. 250 healthcare workers are on modified quarantine where they're allowed to work and they're allowed to go home. The reason we allow for this is there is no one else to do their job. 50 essential service personnel are in isolation. This includes our police, our fire, city operations, refineries, those entities that we need to keep the city going. All of this does not include our hospital, school district, and college, and they will talk to you momentarily. Some people are dying alone due to shortages of staff or unable to ensure a room in our already full hospital, or not strong candidates to endure a trip to the hospital. Our physicians are having to make hard conversations to tell patients and their loved ones that they will die. There's nothing else we can do. I, as the Public Health Director for Casper-Natrona County Health Department, find that hard to believe in 2020 we actually have to have those conversations with individuals. Our physicians are having to make those hard decisions to tell the patients and their loved ones they will die. There's nothing else we can do for them, and that is not always the vulnerable populations or those over 65. Currently, we are diligently working with 14 sites in the community with active cases to try to get a hold of the spread of the virus, which means we have to go out and do mass testing, over 300 at a time, to try to figure out where the disease is at. People are going to work sick, thinking it's allergies, thinking it's a cold, but it turns out that they're positive. They may go home and get a test on their way, and then they've exposed their entire office, leaving them at times in some of our workforce without anybody left to do the work. Places have had to close. Travel to other cities and states does put a person at a higher risk, especially with our surrounding states. You now can go online and find out what states we may not be able to go to, or vice versa. We have the testing technology in the county. We have rapid, surveillance, and routine testing, and people are reporting very sick, and the schedules are very full for all my testing partners. Someday, we'll have a vaccine, but that's not in our immediate future. We anticipate this will go on in the future, and we will see increased cases around the holidays. Change of weather forcing us to be inside, and the continued resistance to do what we can help for our neighbors, those that care for us, and our community as a whole. I know the mass majority of you all, and everyone in our population, can survive and do quite well with the virus. What I'm asking for you to consider is the transmission to the next person you come into contact with, and with who they may come into contact with. All it will take is personal responsibility to not spread the virus to the next person you interact with to slow the progression. People are dying, and I know we all will at some point die, but I want to ensure that I protect the public's health in any way possible to prevent a surge in our hospital that would cause you not to have the care you need if you have a broken arm, or a car accident, or a heart attack. I want to ensure we don't have immediate burials, cremation without services due to no space in our funeral homes and morgue. We actually know how many that takes. Or that we have to move to a lockdown simply because there's no personnel to keep the city operating. I will now turn it over to our county health officers, followed by the other individuals.
Thank you, Mayor, Commissioners, City Council. Thank you for coming. I'm Dr. Dell. I'm one of your county health officers. My goal is just to explain to you from a physician's side what this is like right now and to get you to understand something. Please, 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 this is not political. Please don't make it political. No, just listen, just please be respectful, just listen.
Hey, just a minute.
Please.
Let him talk. Let him
Please.
talk. That's why you're here, is to hear him. Let him talk. Let him talk.
I am. Hold on. Okay. Here's the deal. This is a medical emergency. The goal is to keep you healthy, keep the community healthy. So do you got any ideas?
I'll tell you what. Okay. We need to hear from these guys to make a decision. You need to hear from these guys what's going on. We've heard. We're going to stipulate. Hey, just a minute, Doc. Now you make me feel like Trump. So here's what the deal is. We will clear this room if you don't listen. You've got to listen to what's going on. Please. No, we're going to hear these health professionals first, and then we're going to be around. So, no, ma'am, no. Do you have any idea that if anybody catches COVID in here, where are you going to go to get health care? No, where are you going to go? The hospital is full. The hospital is full, and that's what you got. The CEO right up here, and he's going to tell you that that's the way it is. Okay. Did you happen to hear that we had, in the last 14 days, we have 10 people died in this community from COVID. We had 8 people that are on death's door. We've got a real problem. So he's gonna continue right now.
Look, we don't have to agree on this, but I'm just trying to paint a picture of what's going on. Well, how do you know? Listen. No, wait a second. We're talking medically. That's your problem. You need. Listen. This is we're trying to talk medically here. Medically. Good. I don't think this is going to work. Why don't we just hold it? Can you hold it private session? What are your options?
Well, we can have that.
Department of Justice, Code 18, Section 242. Read it. Amendment 14, Section 1.
You can say it, correct?
Okay. I'm against mask mandate. Okay. Okay. Now let's get one thing. let's get one thing straight. This is not about masks right now. This is not, we are trying to get this out to the public, what is happening in this community. You don't know what's happening. You only get what's in the newspaper. Let the experts finish, and then you can scream all you want. At least give them the respect that they deserve. These people are on the front line every single day dealing with this. And it doesn't, listen, you guys are focused on masks. We're trying to give you a complete picture of what is, ma'am, did you just not hear a word I said? We are not here to talk about masks. We're here to talk about what is happening so that we as a community can come together and figure out how to battle this with or without voluntary masks. We are not here to do masks. Please listen to the experts. Then if you want to get mad, yell at us because we're the ones that are going to make that call. And the state will make that call. We are here to educate you and give you an opportunity to hear what is happening in our community. Give them, sir, they're, you know, sir. Okay, ma'am, first off, this isn't a the commissioners are willing to do whatever, but I would ask you to have the decency to please at least listen to the experts. You don't know what's happening in the hospital. You're only reading part of it. At least give these professionals the decency and courtesy to listen to what they have to say. Again, we are not talking about a mask mandate here. We are trying to get information out. We are not talking. Can we just at least talk? Sir, all I can tell you is the purpose of this meeting was to get out to you what our county health department is facing, what the nursing homes are facing, what's happening in our schools and stuff. This is not about masks right now. It came out that way, but that is not the purpose of this meeting. Please, let's just try and everyone take a deep, sir, if you can't sit down or just let these guys talk. You can yell at us all you want when we're done. I'll sit here and you can yell, all of you can yell at me when we're done. But these gentlemen deserve the right to be heard. That's why we've called this joint meeting. Mayor, the mayor can attest to this. We sat for 2 hours and listened to this last week. We are not voting on anything today, folks. We are not voting on anything. We are asking you to listen, and this is going out to the public. At least let these people speak. We're not here to talk about what's right and wrong. We're here. Well, then you can come to a county commissioner meeting and yell at us. This is an opportunity we are trying to afford you to hear what our public health officials are dealing with and ask of voluntary things that you can do to help curb this. Well, sir, this guy is very polite. He has his hand up. Sir, could you have a question? right now, you seem to have the floor. Okay. 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 Oh, okay. 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 So we're getting off a whole bunch of other things. Let me, without anybody yelling, the purpose of this meeting was simply information. We are not voting on anything. We're not mandating anything. We are trying to just simply give the public what factually is happening. We can talk about what we should have done, whatever, but please at least let these gentlemen and lady tell you what is actually happening. And when we're done, we'll sit here and you can vent at us all you want. We're filming this. We want to get this out here so that people will take seriously social distancing, washing your hands. If you're compromised, maybe wearing a mask. That's all we're trying to accomplish here, okay? So please, we're not here to exercise anything. We're here to just simply inform you of what is happening. We are not making any decisions. We are not making any decisions here. It's simply informational. Please let these gentlemen tell you what is happening. They're doctors, and you can if you want to discuss constitutional rights and all that, that's fine. But that's not what the purpose of this was. So please, when Dr. Dell says this is not political, he has a view regarding masks. He has a view regarding masks. That's from his professional standpoint. We're not asking him to, we are making no decision. He's going to tell you that he believes masks are effective. We are asking, that's fine. We are simply saying, his opinion is, let him have his opinion, and we're asking you to voluntarily listen, just give these doctors an opportunity to tell you what is happening, what's happening in the hospital. Please, just let them talk. When you're done, you can yell at and scream at. We can have a civil conversation, or we can have a nasty one, but at least let them speak. That was the purpose of this meeting. All right? You can agree to disagree, but at least let him speak. And let Dr. Ghanem speak.
All right, let's try again if we could. What we're trying to do is paint a picture as to what's going on in the community right now. And it's important you know this for your families. You know, it's a very contagious virus. In the hospital, as of this morning, and I worked there this morning, we had 31 or 34 patients hospitalized with COVID. We have 6 in the intensive care unit. We have one person, 54 years old, perfectly healthy, that is dying today, and another one, 56, who's going to die probably tomorrow. We have nursing homes that have probably 60+% of your family members infected with COVID, and there's some of them dying. We have doctors, nurses that are infected and can't work. So our concern is, what are we able to do to keep the community safe and healthy and allow you to be able to get in the hospital if you need it, allow us to do the surgeries we need, not cancel all your surgeries that you need for your hip or whatever you need done, and work together to keep everybody healthy and safe and not ill, because if we have a ton of infection in your healthcare workers, we can't do what we need to do for you and your families. And we want to keep your businesses open. But if we have too many workers that are sick, we can't. Our goal is not to torture anybody. I don't like a mask any more than you do. Who does? But we have to wear them. If we didn't think they were helping us stay safe, we wouldn't wear them in the hospital when we're exposed to COVID all the time. I wear goggles and a mask. We have to. No, but our goal is to help all of us stay healthy. And for please. We use them. No, wait, listen. We have the stuff that you're able to get. We give it because it can kill people.
Come on, let him go.
Okay, well, what? No. Really? Where did you get that? That is not the case. We don't have anything. Is there something?
Please.
With the people, I know you said that they were perfectly healthy, but okay, so if they're dying, I'm going to say they weren't healthy. If I were to contract
No, people.
COVID-19
Wait.
right now,
Listen.
I'm healthy. Am I just going to all of a sudden be dying because I don't have any underlying conditions? Do these people have underlying conditions?
No.
None.
No. Wait. Listen. Some do, some do not. Of course. Wait. No, listen. No, it's just like anything else. It's like any infection. If I take whatever you want, a pneumonia, you have young people die of pneumonia that are perfectly healthy, You have older people that survive it that have COPD. It depends. Look, none of this population, none of us have had exposure to this virus before, and we don't have protection. That's why some people die. That's not quite yet. Not quite yet. So, but listen. No, you're not right.
Oh, yes, I am. I heard it with their own mouth. I don't make that shit up.
Okay, well, thank you. Yes.
What about all the other masks? They've done tests on masks, on viruses for years, right?
That's correct.
And they've always proven that it had been 0% effective. And then in 2015, the one study showed 3% ineffective. That means you're higher risk of getting a virus than not wearing a mask.
The studies don't, no.
And then for a bacterial infection, like the plague, right, was when masks were invented and they worked. So we're looking at the plague, that they worked, and never before or never after did they ever work. And that's every single study.
Really?
Before 2020.
No. I'm sorry, no. No. Really? Tons. Did you ever ask the question why people wear masks in an operating room? No, that's not why. Hey, listen. No, wait. Hold it, please. Listen, please. Hey, just, please. Please, that's not why, listen. All we're trying to do is tell you this.
Mr. Chairman, I'm going to point out to the county commissioners, Wyoming Statute 164406, disruption of public meetings. If any public meeting is willfully disrupted by a person or group of persons so as to render the orderly conduct of the meeting unfeasible and order cannot be restored by the removal of the person or persons who are willfully interrupting the meeting, the governing body of an agency may order the removal of the person or group from the meeting room and continue in session, or recess the meeting and reconvene at another location. Mr. Chairman, Commissioners, I would submit that given the tenor of what's going on here, that this meeting is not feasible, cannot be continued as currently concentrated. So it would be my recommendation that we adjourn the County Commission meeting at this point.
Not much use. Okay, just a minute. I want to try something. The commissioners are right here in the front row. Fellow commissioners, how many of you are in favor of a mask mandate? Raise your hand. Just a minute. How many of you are in favor of it? Raise your hand. Okay. Is that okay with you? Can we hear the people now? We're not gonna do it. We're not gonna pass that. We would like the community to know what's going on at the hospital, what's going on in the community. Could we get that out, please? We need these guys to talk. They've got to get back to their job, which is trying to save people. So could we let them talk? Okay, come on up.
Good afternoon. I'm Dr. Ganem. I have zero political agenda. I worked with Dr. Dowell for the last 14 years. We agree, we disagree, but by the end of the day, we listen to each other, we respect each other. By a show of hands, how many in this room hate COVID?
Those of you that didn't raise your hands, you like COVID?
By a show of hand, how many of you believe that we are free people? By a show of hand, how many of you want to stay healthy? Would you allow me to tell you about my weekend? Does anybody want to know what this small guy did this weekend at the hospital? I am not here to convince you that COVID kills people, doesn't kill people. You've already made up your mind. You have heard since March, every single day on the news, how bad that is. You made up your mind whether you want to do things this way or that way. We're divided. It doesn't matter. You made up your mind. There is nothing I can say or anybody in here that can say that will change your mind. And I am not wanting to change your mind. I want to tell you that last night when I went home after seeing 7 people in the intensive care unit with COVID, one of them was tested negative but had a high likelihood, and I was in that room and got exposed. The first thing I did when I went home, when my girls came to hug their dad, I said, "Stay away from me, I need to shower first." And I can't tell you how it is hard for me, my family personally, to go through COVID. So anyone who says, COVID is nothing, I invite this person to look at their neighbors, what's going on in our society, what's going on in this town, right here, right now. We have 30 patients with COVID in the hospital. People from South Dakota are calling us, and they've never called us before, to send patients from there to our facility because they're full. We tried to get patients yesterday to Denver for surgery. They would not take them because they're full. Billings is full, and they're sending their patients back to Sheridan. We all are in the same boat. People who say no don't have an alternative. They say, if we get sick, we get sick. Well, if we get sick, you're not only going to get sick, you're going to go to the hospital. And if the hospital is full, the hospital is not going to take care of you. And I have to stand up with those nurses and talk to them. And one of them yesterday, taking care of COVID patients, in tears. She could not take it anymore. She was overwhelmed. Another one came to her and said, "How can I help you?" She said, "I need a moment. I need a minute." This is one of our sisters and daughters in here that is actually trying the best she can. And she's going to go home, and she's going to worry that she can give it to her family too. Do what you want with the mask. Do you think that if we have a mask mandate, someone's going to go and fine you for not putting a mask on? This is not about fines. This is about respect. I respect this gentleman who stood there and he actually said, I have the right to be heard. I respect all of you. I respect that every one of us has a different opinion. And all what we need right now is to listen to the facts. I told you my experience. I'm just going to let go of this. Going to get Dr. Bleicher, Dr. Dowell, if you'd allow them to speak, to tell you what they're going through. You cannot tell me what I'm going through because you have not been in my shoes, taking care of people dying and looking at you and telling you, Doc, my wife told me that I need to make peace with the Lord because I can die. Is that true? And I said, sir, we're all going to do the best we can for you. So by the end of the day, guys, I don't care if you like what I say or not. All what I'm saying here is this is our life, and for you to say, no, it's not there, does not make it disappear.
Next fish in the barrel. I'm Dr. Bleicher, currently running Wyoming Medical Center. I think you can hear me just fine. I first want to address, if I wanted less COVID patients in the hospital, I'd be here, right? If I wanted more because I was making more money, why would I think masking was a good idea? How does that make any sense? What does that have to do with money? Somebody brought up money. The hospital, the PPE is very expensive. We've had to bring in a lot of extra staff, which is very expensive. Is the hospital full right now? No, did I? Did I? Did I say it was full? Did I say we do a ton of free work? First off, you don't get paid for deaths. Second off, hospitals don't make their money. Hospitals make money doing surgeries and other things. But, so we had in March and April 4 or 5 patients in the hospital with COVID in March and April. If you remember then, Natrona County had, 10, 20, 30 cases? Over the summer, we had about 8 to 10 in the hospital. What were our numbers then, Anna? 100? 120? As the numbers go up, the hospitalizations go up. After the hospitalizations go up, the deaths go up. You can't argue with that. It's a fact. We have 30 patients in the hospital right now. 30 with COVID. 30 with COVID, which is well beyond any other diagnosis we have in the hospital. The other thing I'd like to address is the cavalier way in which you dismiss people with chronic diseases. Over 40% of this country is obese. That's one of the highest risk factors. So I don't understand why you argue that somebody with diabetes or hypertension or obesity or heart disease should die. How does that make sense? But you're dismissing it. You're dismissing that only patients with chronic diseases. The more chronic diseases you have, the more likely that you're going to have issues with this. But there are people that were healthy before this that are dying. We had one from Lander that was 40 years old that we didn't take that passed away. I don't think you guys are getting the gravity of this situation. I'm giving you COVID statistics. I'm just telling you statistics about the hospital. Are you listening? Okay. So don't say it's not a real thing. It is logic that the number of patients in the community that have it parallels how many are hospitalized than how many that die. I don't even know what you're talking about. I'm not paying attention to any of you. Most everybody else is listening. I'm not listening. We have plenty of PPE currently at the hospital. We have an expert at the hospital, yes. He's not here today, but yes, he advises us on all of our masking. Absolutely. He worked for OSHA, and now he works for us. Okay. Okay.
You know, we really wanted to give the community some information, and this is on YouTube, but this isn't giving anybody any information about what's going on in Natrona County. So I would call this meeting adjourned, eh? Yeah. Is there a second? It's been moved and seconded to adjourn this meeting. All those in favor say aye. Shame on you. We're out of here.